Hi, my name is Eric Singer. I'm a urologic oncologist, chief of the Division of Urologic Oncology at The Ohio State University in Columbus, Ohio. The kidney cancer landscape has just changed so dramatically from when I remember as a resident reading the first papers of targeted therapies being approved in 2005, 2006, to where we are now, where we're able to offer carefully selected patients adjuvant therapy for the first time to try to reduce the risk of having high-risk kidney cancer come back. So I'm very excited in terms of how we're combining surgery and systemic therapies to get even better responses and better outcomes than we've been able to with either of those alone. The adjuvant space has really been a great focus recently, where we have Prosper RCC as well as the Keynote 564. So 2 trials, both using immunotherapy, trying to reduce the risk of having cancer come back after surgery. Prosper RCC was a fantastic design in that we were able to give patients a dose of the medicine prior to surgery, trying to take advantage of all the antigens present in the tumor, hoping to see a better response to immunotherapy after surgery. Unfortunately, that trial ended up being negative, but we certainly learned some critical lessons that we're going to apply to the upcoming round of adjuvant trials that are getting ready to open. Keynote 564, which was purely adjuvant, meaning patients had surgery and then got medicine, there was no medicine before surgery, did show an advantage. It showed an advantage in terms of progression-free survival, so patients having cancer come back, and we even saw a benefit in overall survival, so patients living longer. But now what we're really charged with doing is figuring out who are the patients who most need that therapy. One of the problems with adjuvant therapy is, by definition, we're going to be over-treating some people. And there are some real costs and toxicities that come with that therapy. So we need to now think more carefully to decide who we should best treat with this new option. So it's not just what could we do, but what should we do, and to help get more precise with those recommendations. It takes a village. So I work so closely with my GU medical oncology colleagues, our GU pathologists, our radiologists, radiation oncologists, really to make sure we put together the right team to offer the right therapies at the right time for each individual patient. Our APPs, advanced practice providers, physician's assistants, and nurse practitioners are critical. They bring such important insight to the care team and our patients. And I'll also mention our research team. So our research nurses, research associates, who are so critical in ensuring that we're getting good data and that we're also ensuring patient safety for those volunteers who choose to participate in our research studies. So our community partners are fantastic, and I'm super excited to be able to support them. So whether it's second opinions, phone consultations, talking about a case, having a case presented at our tumor board to get additional input, referrals, second opinions, co-management. We're really here to help everyone do better. So obviously there's a lot of data that shows that for very complex things, having that type of surgery at a high volume center by a high volume surgeon is a benefit. And so we're always happy to help in any way we can with our community partners. So it is such a team sport, and I can't emphasize enough how proud I am to be at The Ohio State and the James Cancer Hospital, who does that team sport at such a high level. It's been a great pleasure and privilege of mine to be part of the Kidney Cancer Association and to be involved with the International Kidney Cancer Symposium. I had the privilege of helping to run that meeting several times And it's always a highlight of my academic year to be able to be here with friends and colleagues and patients to talk about the next steps in what's going on with kidney cancer. So to me, it's a critical piece of what we do to gather here like we do every year to not only reflect on what we've done, but to really look deeply into where we need to go. Because we can't remain static. We need to keep pushing boundaries and getting better for our patients.